to read the
Marie
question.
was on a little bit ago. I don't know where she is now.
We just had flickering. We didn't really lose any power here.
It's just a fairly decent part of East Greenwich though that did, so
Yeah.
our office lost power.
And Mr. Marcaccio is texting me and said much of Meadowbrook is without power too. So, and that's a Meadowbrook High School area that typically, but we do have 94 attendees already. So we do have an audience.
Meadowbrook and the high school are without power.
Yeah, we are still without power.
Hi,
I
Dr.
back up to
Rainey.
the high school. Hi, how are you, Denise? Hi, Howie.
Hi, how are you?
Good, how are you?
Good.
So we'll wait.
Well, it looks like everyone's here. We're ready whenever you guys.
Okay.
Here. Hey, Howie, I know we haven't talked, but my plan is that I'll like defer to you. I will back you up. So that's
All
the
right.
plan.
Sounds good.
I told Denise, you're my kid's pediatrician. So like,
Well, I mean, I think that for better or worse, nobody knows the answers.
right.
You know, so we'll do our best and we'll make sure that people understand that it's, you know, it's a fluid situation and it's evolving, and hopefully they'll be accepting of that.
Yes.
Denise and other members of the group, this is Jean Marie. I can only be on by my phone because I'm in a place without internet right now. So I'm on a dial-in, so I can't see the page, I can't see video, but I'm here, audio.
Well, thank you for being here, and I will begin the meeting and welcome everybody with us this evening. I do see at least 124 folks with us thus far, so I imagine we'll have some more join us. I know that some folks are without power, but hopefully they can log in with their phones or access that. We are recording this session, so you'll have the opportunity, folks without power will have the opportunity to review it or watch it at a later date. I would like to take the opportunity to welcome our panelists here this evening and thank them all in the most genuine and sincere way for all of the work that they have been doing thus far. And I'll start with introducing Mr. Wilmarth, our Director of Facilities. And I'm just going to go through the boxes that I see here. Mrs. Green, school nurse teacher at Eldridge. Mrs. Simmons, school nurse teacher at Frenchtown. Mrs. Sullivan, school nurse teacher at Meadowbrook.
Get on the internet.
Mrs. Jarmy, school nurse teacher at the high school. Dr. Silversmith, our district pediatrician and local pediatrician. Dr. Wren, who is joining us this evening, and she was just done with MSNBC, so how lucky are we to have you here? Dr. Arnoff is in the background, our Director of Technology, helping us to navigate everything, and Jean Marie Vaughn by phone, who is a school nurse teacher at Cole Middle School. So we have been fortunate in receiving many questions from our parents, and we appreciate all the questions that have come. The school nurse teachers have gone through the questions and categorized them. So they will actually be reading them off. Some are directed towards Mr. Wilmarth, our Director of Facilities. Some,
Thank you.
just a reminder to mute if you can. Oh, Dr. Arnoff, they're asking if you can let Mrs. Wilson in, school nurse teacher from Hannaford. And we do have 142 guests. So without any further delay, I think I'm sending this off to you, Mrs. Sullivan, who will be asking the first question.
Okay, I will be navigating between a couple of screens here, so just a second. Oh, there's Cindy Wilson. So we surveyed everybody, as you know, and we got well over 100 questions come in for Dr. Silversmith. And as we got some questions as well from Dr. Hughes, we tried to put the questions into categories that made sense. and we got rid of any duplicates. And any stories, we're not going to be able to share stories. We just are here to answer the questions. So Jean Marie, are you ready to start?
You have to unmute, Mrs. Vaughn.
Okay, she's having difficulty unmuting, so I'm gonna go ahead and get started. So we're gonna get started with the infection rates and risks. So this is for either the doctors on the panel. How risky is it for kids to pass along COVID-19 viruses to family members?
So it's actually an interesting question, and it's one that we are finding out more and more every day. There were some initial studies that looked at children under the ages of 10 or 12, thinking that they are very unlikely to transmit virus to each other or their parents. We know that it's not an absolute that they can't, but we do know that under a certain age, there is significantly less transmission from child to parent. Once you start getting past the age of 10 or 12, the infection rates are the same as they are as from adult to adult. So certainly once you are talking about high school students, it's fairly easy to transmit virus. And I think the studies show overwhelmingly that if you maintain a 6-foot distance and mask wearing, transmission rates are significantly lower than if you do not socially distance to 6 feet and wear a mask. So we do understand that most kids in their own households are not going to be wearing a mask and socially distancing from their parents. But we are at least a little bit reassured that in the younger ages, transmission to the parent is unlikely.
Okay. So with numbers higher now than they were in April or even May, how can we be sending people back to school? And should we be concerned about infection rates rising with the flu season or a second wave of coronavirus?
So infection rates are actually lower than they probably were in April and May. They are certainly higher than they were in early July and end of June. But we were recording 300 to 400 cases per day at the peak of infection in Rhode Island, and that is with significantly less testing than we have now. So with much better testing, our infection numbers are really hovering right now at about 100 per day, with a positivity rate that is significantly lower, depending upon whether or not you use the Department of Health site, which is claiming about 2 to 3% positivity, or the Johns Hopkins site, which is claiming about 5% positivity, which is really just a matter of how you do the calculations. Either way, that is very, very, very much below the 15 to 20% that we were seeing. The question of whether or not it is safe to go back to school now with higher rates than there were a month ago, I think that is exactly why the governor's office and the Department of Health is waiting till August 17th to make a final declaration to see which way those numbers are going. It would be nice if we were at that 50 cases a day where we were, but certainly at 100 cases per day in Rhode Island, if we stayed here, that is not a rate that most people would consider unsafe to be in phase 3 or phase 4, which certainly allows for schools. But certainly those numbers can change rapidly over the next 2 weeks, and certainly can change rapidly once schools open. And I do think that is exactly what the governor's office will be looking at.
Okay. So the next question that was submitted says, why are you going against the Academy of American Pediatrics guidelines and the demand of the President of the United States by not opening for 100% in-person learning?
So I'm going to take that in 2 parts. The first part is the American Academy of Pediatrics. Their initial statement was quite aggressive, but it really didn't focus on risk. It really just focused on how students learn the best. And it was very, very aggressive in its statement that due to many inequalities in our system, every student, but certainly vulnerable students, are benefited by being in the schools, in person, full time. And I think everybody on this call can agree, knowing the quality of the education in the East Greenwich School District, that absolutely these kids are getting an outstanding education being in school in person. The American Academy of Pediatrics quickly walked back that statement once they realized that it was taken a little bit out of context, I think, to include whether or not there was a risk of transmission based on community spread. So the American Academy of Pediatrics statement certainly does not state that every school should open 100% in person fully. They have walked that back, and they definitely state that you need to look at community spread and the safety and health of students and teachers before you say every student should be attending school in person. As for the President of the United States, I certainly will stay apolitical here, but I would not be utilizing any of his guidelines when it comes to the safety or health of the students that are under our care collectively as a consulting physician, a superintendent, school nurses, and I just don't believe that he should be making that decision.
Denise, you're muted again.
If it's not safe to have weddings of more than 50, why are schools opening?
I actually think that that's a very good question, and certainly I understand that. And I don't think that it's true that it is not safe to have a wedding of 50 people. I think that in the governor's guidelines, and again, staying slightly apolitical, I think she has done an amazing job at walking the fine line of allowing us to function as a society, yet remain safe. I think she's doing an incredible job. I do believe that in minimizing the number of people at a wedding, it's not to say that that wedding is safe. It is to say that should that wedding have one attendee who is infected, the number of people that that person can infect is smaller. I think the declaration is that a wedding may be something that is more reasonable to hold to a smaller number or to be put off to a safer time than schools. So it's certainly not that a wedding is unsafe and schools are. It is that a wedding of over 50 people is considered a riskier thing right now for us that might not be necessary when, if we can safely open the schools, we should.
And if I can add in there just briefly, it is around the idea of prioritizing our children, right? That if you have to make a decision, the best possible scenario is for our kids to go back to in-person school. And so if we have to choose between two things that may have a similar infection risk, let's choose our schools over the weddings.
Thank you for that.
Okay,
Dr. And Dr. Silversmith.
well, I didn't really understand this question. Maybe you'll understand it better. Will any consideration be made for children who may be at a higher risk of being exposed to COVID due to their parents working directly with COVID-19 patients?
I think that question is probably directed at people like Dr. Rani and myself, who certainly are being exposed to COVID patients and potentially going to be considered exposed, and that would put our kids at risk of having to be quarantined. So I know that East Greenwich has a good number of families where parents are physicians, nurses, firefighters, police officers, and their risk of exposure is certainly higher than many others. So if it's going to be, is there going to be consideration that those students are going to be allowed to stay home and do virtual learning for 14 days while their house is quarantined? The answer is absolutely. I think that that is going to be across the board for any person, any student who needs to be quarantined. In terms of other special circumstances, I don't see any others, but again, I might be misinterpreting the question as well.
Yeah, and the other thing I'll add in there is that right now across the state over the summer, we've seen very, very, very few infections of healthcare workers, because when we see COVID positive patients, we are lucky enough right now, thanks to the foresight of our clinics and our hospital systems, to have adequate personal protective equipment. And so the number of people that have been infected in the healthcare setting in Rhode Island has been tremendously low. Where people have been infected is by going to bars, by going to family parties, by going to social get-togethers. And so in many ways, the risk is higher for folks who aren't in the healthcare setting and are going to these social events without personal protective equipment, without masks, without social distancing, rather than for those of us that are seeing patients with an N95 and a gown and gloves, et cetera.
Thank you for that. So we're going to move on to masks. We've got quite a few messages about masks. I think there's like 13 questions here. I'll try and condense them. So will masks be required, and what grades are expected to wear them?
Do you want me to go ahead, Dr. Silversmith? Go.
The first thing I was going to say, and I think Superintendent Meyer, you probably are better equipped to answer, are they going to be required? But what I want to point out is I know that there's a lot of concern about children wearing masks. And I do believe if starting now, parents are good about telling their kids that they're going to need to be in a mask and practicing at home and practicing going out, children will do very well at every age, you know, from kindergarten up. I think that they do have the ability to do it. What we're seeing in our office is unbelievable compliance from the 3 and up age group, which is what we're asking. And oftentimes it's more the parent whose mask is falling down and fidgeting with it. But I do believe that if we right now, not, you know, September 1st, say to kids that they have to wear masks, they will do it. And like I said, I've been amazed at how well they're doing it in our office. So yes, I think, you know, Superintendent Meyer will comment that we are going to require them. And I think that the kids are going to do an amazing job with it.
Thank you, Dr. Silversmith. And yes, it will be accepted and it will be required for students to wear masks and staff as well. Our youngest learner, our preschool learners, you know, that is to be determined about those, but it is expected that our K-12 students, unless they have some extenuating circumstance, that would be determined based on the individual building, school building principals or with the school nurse teachers about that. But yes, again, masks are expected and required.
So can I piggyback on that a little bit? So Dr. Silversmith, would we need documentation from a student's doctor if they are not able to wear a mask?
I think we would need to. I think that there really are no medical conditions that absolutely prevent you from wearing a mask. They are uncomfortable. I know people talk about asthma. Absolutely, with asthma, it is okay to wear a mask. They've done study after study after study with cloth masks, with surgical masks. They do not lower your oxygen level. You do not retain carbon dioxide. There is no risk to any student who is medically who has a medical condition such as asthma. I see somebody's posting in terms of anxiety. Yes, I think masks do make kids anxious. I think that certainly there is a feeling, a sensation of having a hard time breathing, which is again why I do believe that if we start now, kids can overcome that. If we have somebody who can't, there can be mask breaks. We can talk about, you know, that child doing distance learning. But I do believe that in terms of anxiety, cognitive behavioral therapy works great, and we have a month to do it. I see somebody else posting about developmental disabilities and sensory issues and intellectual disabilities. Those are absolutely reasons why children will have a hard time wearing masks. And that is where the school will take it case by case with 504 plans and IEPs, and certainly involving the child's pediatrician in the discussion of whether or not that child can wear a mask. But I do believe fully that yes, there are some students because of intellectual or developmental issues that will not be able to. But in terms of some of the other things, I think we can overcome that.
And I
Thank
would
you.
just follow that with, you know, thank you for Dr. Silversmith, your suggestion about including the pediatrician in on the conversation. That's just helpful advice for us as we think through some of this.
What about masks and recess?
I think that, you know, again, right now we're seeing outdoor spaces with 6-foot distancing. Masks are not entirely necessary. I know a lot of these kids are at the beach right now, not wearing masks in stable groups. Personally, I think if your concern is your child's safety, you should instruct them to wear a mask. I know that masks have not been proven all that great to prevent you from getting infected, but there is some data that they probably do help. But if your concern is having your child not be the one who spreads it, again, I think to say to your child, when you're in a school setting, I would prefer you to wear a mask. I don't think that's asking a lot of your child. So yes, I think there should be times throughout the day when kids can take a break without wearing a mask. I think if it's outdoor recess, it is a great time for them to have that opportunity. But certainly, I think the more we impress upon the students that they should be in a mask as much as they can tolerate it, even at outdoor recess, a mask is not a bad idea.
And just to add on to Dr. Silversmith's point there, the mask is a little bit to protect the kid from getting infected. It's to protect them from transmitting it to other kids. It's to protect them from transmitting it to the teachers. And if they can avoid getting infected, it keeps them from bringing it home to you and from your whole household having to be quarantined or infected. And I know that many of our parents deal with health issues ourselves. And so to think of it, it has a additive effect in terms of not just the safety of your own kid, but in terms of the safety of your family and of that larger school community as well. So it's doing something for the safety of all of us rather than just for you individually.
Thank you for that. Why do they need to wear them all day and not just when they are out of their stable groups?
Stable groups are an interesting concept. And I think that the concept of stable groups is not because they can't spread illness to each other. It is simply for contact tracing. To assume that just because you're in a stable group means, okay, this group can all infect each other happily is not what we intend with a stable group. Stable groups are for contact tracing, and it really is so that we can minimize the number of people that do need to be quarantined should there be an infection. And when you talk about stable groups, as Dr. Rani had earlier stated, right now where we are seeing the largest outbreaks are stable groups of families. It's, bridal showers, birthday parties, backyard barbecues of people that think they're in a stable group. It's their good friends, it's their family. So certainly the stable group is not intended to say these kids are all being exposed to each other. It's to say, if somebody in this stable group gets infected, we can contact trace, we can quarantine, we can isolate, we can minimize the spread.
Can a student wear a face shield instead of a mask?
It's not ideal. Again, I think that in conversation with a child's pediatrician or family practice doctor, potentially, I'm not going to say that it is an impossibility, but a face shield does very, very, very little to protect either A, acquiring virus, or more importantly, spreading virus. A face shield really works to protect your eyes, not really, anything coming out of your nose or your mouth. So a face shield would be only in small circumstances where some sort of medical professional is talking to the school as to why that child cannot wear a mask.
Okay, let's see. So what if, we already touched on this, what if my child has a panic attack or feels she can't breathe? I'm assuming we're going to give that child a mask, right? How do you, and here's another one, are preschoolers required to wear masks?
Are preschoolers required to wear masks? Was that the question? That's a
Yes.
piece that we have to yet determine within our school and within our preschool. We would ask for guidance from the Rhode Island Department of Health, but I think they would fall under that category of the age group for preschoolers, where preschoolers would fall under the category of where masks are required. I don't know if either Dr. Silversmith or Dr. Ranney would want to comment on that about, our 3-year-olds or our 4-year-olds.
Again, I know that right now, most of the information out there is anybody over the age of 2. We certainly do understand that between the ages of 3 and 5, it is more challenging to have them keep on the mask. And I think the important thing to know is, as much as they will be required, children are not going to be kicked out of school for not being able to wear a mask. What we're trying to prevent is people who are adamant about sending their child without one, or being obstinate about the fact that their child will not wear one. But certainly, if there's a preschooler who is sent with a mask and is trying to do a good job, we will work with that student. And again, only speaking from experience, I've been amazed at some of the 3, 4, and 5-year-olds who wear a mask and keep it on the whole time. And I would have told you a month ago, 2 months ago, no way would a 3, 4, 5-year-old wear a mask. Again, they are doing better than some of the high school kids. It's the high school kids sometimes who come and who have it hanging below their nose, and you have to say to them, please pull that up. And then they do. But you don't even have to prompt the 3, 4, 5-year-old. They actually are doing a better job than most people would think.
I am concerned about the air quality in the classrooms with masks on.
Bob, do you want to take that one about the air quality, or is that?
Didn't hear it. It was choppy. Sorry.
I am concerned about the air quality in the classrooms with masks on.
The air quality in the
Yeah, I heard it. I guess I'm just not sure.
Yeah, masks shouldn't, if anything, they should improve the air quality because they're keeping people from breathing things out. So the wonderful thing is that if anything, they'll improve the air quality in that room.
I would agree. Yeah.
That's basically what masks were initially invented for. I mean, most of the people, initially when no one could find N95s, the only place you could find them was hardware stores, because it's for people who are working in poorly ventilated environments with dust and inhalants. So certainly, I think that if anything, yes, it will improve it.
How do we protect other students who are with students that refuse to wear a mask?
So I'll answer this one. Refusals are not an option. If we have extenuating circumstances where there's, something that is specific to a child and we need to work around that, we will. But the expectation is not only in, even from the Rhode Island Department of Health, and I think most updated CDC guidance for wearing of masks in school settings to keep everybody safe. So that individual situation would be dealt with at the building level with a conversation with the family as a means to, have mask wearing part of the experience for being in school this year.
Okay, last one on masks. Since eating requires removal of masks, will students have lunch with the same stable pod each day, or will they be exposed without a mask to a different group of students without masks? How is this safe?
They will be eating lunch with their stable pod. The Rhode Island Department of Health guidance allows you to have more than one stable pod in a larger setting, but they need to be 14 feet apart. So we don't anticipate many of those opportunities. We are considering the ability for kids to eat outside at some point with their stable pods. We've even started to look at some smaller tents as a possibility to provide some shade, but yes, they will be eating in their stable pods. I just think it's important too, as we're mentioning stable pods, and Dr. Silversmith indicated this, stable pods, if a child is riding the bus, that's another stable pod. So there's more than one stable pod that a child could come into contact with in a school setting.
We have more questions about pods later on.
Okay.
Cindy Wilson, are you up? You're ready for your question?
She's on mute.
She's muted.
All right, I guess I'll take it.
Um,
Cindy, can you unmute yourself?
Ready?
I think I unmuted.
Yes, you did.
Thank you. These questions are about self-attestation and temperature taking. Will there be any sort of temperature screening upon arrival? Why are temperatures not being checked for students and staff when low-grade temps have been shown to be an indicator?
Do you want me to answer that or?
So I'll say right off the bat that we know that for kids in particular, a lot of them are asymptomatic, and the temperature screens are not a great way to identify. Certainly, we don't want symptomatic kids coming in, but temperature screens are not the best method. The really important thing is for parents to keep your kids home if they're feeling sick, rather than counting on a temperature screen. The other thing is the process of doing a temperature screen is going to expose a lot of kids to each other because they're going to be close together, and it's going to expose a lot of staff to those kids in close quarters. So it would actually most likely increase the risk of transmission within the school setting.
And the other issue is it's time consuming. It's very time consuming. And I think what we're trying to do is minimize the amount of time that children need to be in the buildings themselves. So to take any of the time away from education to do temperature screenings doesn't make sense. It is why the attestation daily is so important. It is so important. And certainly with that attestation, it should not only be thinking about whether or not your child has symptoms, but taking their temperature before they go to school and not sending them if they do. So certainly we are relying on temperature screenings. We're just not relying on the school doing them. We're ideally having parents do them.
Thank you. Having to do with the self-attestation, who will these reports go to? When will the parents need to submit them by? What time will the nurses receive the information daily? And if a parent does not submit self-assessment of their child, will the child be allowed to attend school that day?
Okay, so there will be a time frame based on each individual school before school starts. So yes, there would be an expectation that that self-attestation is submitted. It is expected and required that you do it on a daily basis. At this point, we're building what we believe to be a system in our Aspen student portal so that so that it would be easy. The parent would go in there every day. We cannot, based on guidance from the Rhode Island Department of Education and the Rhode Island Department of Health, prevent a child from attending school if the attestation form is not filled out, but we have been having discussions between and among the school nurse teachers and even with Dr. Silversmith about how that will be approached. Parents will be contacted, and we will be very clear that it is expected that this is filled out every day. We have been told also by RIDE and the Rhode Island Department of Health that we must collect the information daily.
Thank you. Will there be regular temperature checks for students, especially during flu season?
So
I can answer that. Obviously, if a child is symptomatic, we will be taking their temperature. We will not be going into the classroom and going desk by desk because it's flu season.
And there, I'll actually remind people that flu and COVID-19 are two very, very different viruses. And so it's why it's so important for your kids to get their flu shot this year. I mean, it's always important, but this year more than ever.
Thank you. The next questions are about testing. Will all students or staff be tested for COVID prior to school beginning and/or routinely, or if there's an outbreak, so contact tracing can be done?
So I think that question is really more for the Department of Health than for the school district. The school district does not have any testing capability whatsoever. Unfortunately, right now in Rhode Island, I think we're seeing that we are really struggling with testing for all patients, symptomatic or asymptomatic, but certainly with children. The options for under 18 right now are not great. I know our office is testing, but not a lot of pediatric offices are. Our capacity, though, is not great for numbers, and turnaround time for tests can be as little as 3 days, which was what we were seeing at the best turnaround, to as much as 15 to 16 days, which we were seeing as recently as last week. So until we have developed a rapid testing system in the state of Rhode Island, I don't foresee testing students or teachers routinely. That is not to say that come September, October, November, that is not in place. And I do believe, and I know that, along the chat questions people are asking about it, I do believe that is where we will find success. I think that once we have significantly adequate testing and rapid testing, we will be able to greatly reduce the spread of this virus, mostly through early identification, contact tracing, and quarantining. So until we have better treatment, until we have a vaccine, that's all we have. Unfortunately, rapid testing is very limited and right now is being bought up by the federal government. Our office is trying very hard to purchase any rapid tests that we can, and we've been told that best cases will have it sometime in September. So yes, I think testing will be amazing once it's there. I don't ever see it being done at the school level, but I do foresee an environment where the Department of Health will contact every person who has been exposed, and we will have rapid testing and be able to proceed with more clarity.
What do you find the current turnaround time for test results is now?
So I commented on that a little bit. Again, so, I don't like recency bias. In the last week, our turnaround time has dropped again. It's been a little bit better. We are less than a week, but 2 weeks ago, 3 weeks ago, we were telling people it was 3 to 5 days, and overnight it went to 14 days. So right now, I think average turnaround time we're probably seeing in Rhode Island is about a week, but that is right now today. And certainly the majority of Rhode Island is using Eastside Clinical Labs, and they were overwhelmed. Until we have significant rapid testing, I think we are at the whim of commercial labs, and there's just no way to know. But right now, it's probably close to a week, maybe 2.
Thank you. The next group of questions is about isolation, sending home students/teachers with symptoms. What are the protocols for when a student or a staff person is sick?
You want me to respond to that?
Sure.
I can comment a little bit. I think Superintendent Meyer could comment more. But but this is not going to come from the school district in terms of these guidelines. These guidelines are directly from the Rhode Island Department of Health. They did release a playbook for the daycare centers and the camps when they opened up, and it is very, very clear what they expect to be done when a student or daycare child or camper is either a presumed case or a known positive case, or when a daycare worker eventually, and I hope the K through 12 playbook, a teacher is either presumed positive or known positive. So it's not going to come from us, it's going to come from the Department of Health, but the plan will be to be overly conservative with minimizing spread. And again, Superintendent Meyer may have a little more guidance to exactly what they're looking at as guidelines, but I don't want to state anything too much on August 4th, because certainly by August 31st, that may change.
And thank you for that, Dr. Silversmith. And we do await more playbook from the Rhode Island Department of Health. I do know that the school nurse teachers will be meeting, and I think Dr. Silversmith as well will be meeting with them tomorrow, if I'm correct. That's the first meeting that will happen. We have set up in our schools, or are prepared to set up, an additional room beside the school nurse teachers area, so that we have an isolation room is the direction that we have been given. So we have protocols in place to do that. In terms of the contact tracing that will come, should we, and everybody is saying it's not if, it's when. So when we know we have a positive case, however that may be, whether it's somebody inside the school day on that day or information that we've learned from a phone call from the parent or the Rhode Island Department of Health, we will follow their guidance. We have been asked to provide a liaison, which we have done, and Mrs. Simmons is our EG liaison to the Rhode Island Department of Health. So we have that pipeline already established, and will readily follow their guidelines and direction, and look forward to that as well.
Mrs. Meyer, you've become an epidemiologist.
I'm feeling that way a little bit, but I have a lot of great people around me to help me know and understand all of that now.
So to finish up this area, if a child has a fever in school and is sent home, how long will they be home for? Does the 24-hour fever-free rule apply, or will it be longer?
So again, I think that really involves what type of testing we have. In a perfect world, we will have fairly reliable rapid testing. If that child is seen the next day in a pediatrician's office with a negative COVID test and low suspicion for COVID, and again, we can only look to the playbook that was released to the daycares, and certainly to the daycare with negative COVID testing and symptoms that are not consistent with a presumed case. Yes, I do believe that we will go back to 24 hours fever-free until we have either reliable rapid testing or reliable turnaround to RNA testing. We are looking at anybody who's presumed positive, which interestingly is not just fever, but fever and cough puts you into a very high risk category that even with testing, those are students who the Department of Health may hold out until they meet criteria for returning to being in the environment, not only schools, but being allowed to go to Walmart and the supermarkets and everything else. Those students who either are positive or are presumptive positive should be home until no fever for more than 24 hours and symptoms that are resolving, and 10 days from symptom onset, which is a very, very, very big change from what we're used to. But yes, I do believe that what we're looking at this year is a good number of students who miss, not 10 school days, but 10 days from symptom onset. So potentially 2 weeks of school until we know what's going on. But that will be what hopefully is outlined in the playbook. It will certainly be based on a lot more than just they did have a fever. But I think the Department of Health is working right now on exactly who should be held out for how long.
Thank you very much. Leslie will continue. Mr. Green?
She's coming, she's unmuted.
I'm here. Sorry about that. Just to piggyback on that, there were a couple of questions that related to concerns about parents medicating their children if they in fact have a low-grade fever in order to send them to school, and exactly what can we do to ensure that parents don't do that and keep children safe.
So certainly there's nothing that we can do to ensure it. I mean, people have the free will to give their children medicine and do what they want. And certainly we are not in a position to be punitive or punishing. However, I think that this year, everybody needs to fully understand that it's a different year. And we do understand that there were times where your child had a low-grade fever and you thought that they weren't infective and you gave them some medicine to make them feel better and sent them off to school. And certainly no harm was intended, but maybe a child was medicated who might have had a low-grade fever. We understand that your child had a cough and maybe it's their asthma or their allergies and you sent them. This is a year where we really are asking people to very, very seriously look at the questions on the daily attestation, take them seriously, and really keep your child home. And I think over the last few years, the schools have done a great job to reduce unnecessary absence. We've really, really focused on having kids have less than 10 absences per year, and it's been amazing. But I think this year that goes out the window. If you have more than 10 days out, that's okay. And distance learning will be in place and we will educate your child. But that AM attestation needs to be taken very seriously. And I just think that when you look back at sending your kid to school and thinking that in hindsight, it was them that infected somebody who infected somebody and somebody passed away, it's nothing I think any of us want to live with. So I really think that most people are going to take it seriously. Maybe I'm being overly optimistic, but I think that the parents of East Greenwich fully understand what's at risk here. And I think that my level of concern of medicating low-grade fevers and sending kids to school this year is as low as it's ever been. I just don't see anybody doing it.
I'd like to make
Can
one
I
comment.
interrupt, Leslie? Go ahead.
I was going to say one thing. Somebody just made a comment about staff as well. Staff are going to be responsible for the same determination at the beginning of their day before they present to school. So they have the equal obligation to address how they feel that day and if they're exhibiting any symptoms. So I hope that helps.
Well, I think along those lines, I think doctors are probably, some of the worst in terms of this. We've been taught that unless you're on your deathbed, you should go to work. And this is a very different year for us. I mean, everybody in our office, every doctor, every nurse, every front desk person is doing an AM temperature check. We're taking it seriously as well. And certainly we understand the concerns of us missing a day of work. We have a lot of patients scheduled, but I do believe that, again, this is just a different year and nobody in this world is an essential enough worker that you want to go to work, you want to go to school when you are sick and risking spreading this to somebody else. And I think that's the message that maybe from the top down is not really being heard. But nobody in this world is that essential, and everybody has to understand that.
So I just want to interrupt real quickly, Leslie. There's something in the chat that says, so in this scenario, they can't send their kid to school because they're quarantined, but they're not sick. They're waiting test results. Will they have access to home learning the entire time?
And my response to that is, it is anticipated, yes, and we are working on that distance learning model, if you will.
This next question is to Alexis and Howard. What happens when a teacher gets sick? Let's say she comes down with a fever and she's at school and she gets sent home and she's awaiting test results.
Go ahead, Dr. Silversmith.
No, I think this is more, to me, medically speaking, she goes home, but I'm not the one who has to replace her and, know who watches that class. So I will defer to you.
Well, thank you for that. And yes, we would have an obligation to make sure that class is supervised. But again, it would be a conversation to, Rhode Island Department of Health and get some guidance about, what, if anything, has to be done with the students. Are they going to be required to quarantine at some level based on whatever testing the teacher has or results that come back? But we have provisions in place or are planning for having some additional staff available in the event that we have to respond in a short-term nature or quickly during the school day.
I'd like to say one thing. Some of the questions that are going to come up in the future have a lot to do with what the protocols are going to look like when under those circumstances. There was a playbook that was created and published by the Department of Health to help guide daycare facilities. we're anticipating something similar for the school setting. Very specific protocols about potential exposure. If the teacher had any contact within 2 days prior to the onset of symptoms, there are very specific guidance regarding what happens when a staff person exhibits symptoms, when a student exhibits symptoms. What does quarantine look like? There's a lot of different scenarios. It's almost an algorithm type of approach, but that is information that is forthcoming, but it's going to be based on something that we already have access to. So those protocols are in place. It's going to even delineate whether or not a sub can immediately be placed in the classroom, as opposed to not, depending on exposure. So that's forthcoming and evolving as we speak.
The next question has to do with a student. If a student has to go home and they spike a fever because they spike a fever at school, will the siblings, if they're in the same school district or another district, be sent home too? And if they are positive, will the family members have to be quarantined for 14 days as well?
So in terms of sending the siblings home, if the siblings are not showing any symptoms, there's no need for those children to be emergently rushed out of school. Certainly, if a parent is coming to pick up one student and there are siblings in that school, it's helpful to pick up those kids at the same time, because yes, if a student has a fever, likely the Department of Health is going to consider that a presumptive case, and the siblings are going to be quarantined until either a negative test or that quarantine is up. In terms of a positive test, so there are certain things that we do know right now, and yes, absolutely, if a child is positive, every single person that within the 48 hours prior to that person having symptoms needs to quarantine for 14 days. Will that change in the future? Maybe. But again, I think that unfortunately, a lot of times we're saying we're not sure, and we're waiting on a playbook and we're waiting on protocols. That protocol is in place. If there is a known positive, absolutely that family is quarantined for 14 days. If it is a suspected case, that family is quarantined until we know that that student is negative.
Thank you. The next one is for Alexis and Howard as well. What will be the protocol if there is a case of COVID in my child's classroom, in the school, and what is a family's member? What if a family member with whom they live with tests positive?
So again, if a family member with whom they live tests positive, that student is quarantined. They cannot come to school. And that's where, again, the distance learning will have to kick in. If there is a case in that child's classroom, right now it is looking again as if that whole classroom will be quarantined. But those are the things that we don't know yet. Those are the things that will be in the playbook. It will be who gets contact traced and who gets quarantined from either A, a known positive, B, what's considered a presumptive case, and then C, who has symptoms of COVID, but is unlikely to be a true case of COVID. And I think that's what we have to understand. And I see one question in the chat about, a daughter who has asthma. We know that there are kids who have allergies, who are going to have runny noses and sneezing and a cough. There's going to be a very big push to identify what is a new onset cough, what is a new onset cough with fever, with shortness of breath. But the daycare playbook does do a good job at allowing us to know what we think is a presumptive case. And those protocols will be followed to the letter of that playbook, and we will follow the algorithm. But right now, it's just hard to know exactly what's going to happen because we don't know how strict the Department of Health is going to be with every kid who shows any sign of illness. But it is very easy to know what happens if there is a positive case. Positive cases right now, any single person who was exposed to that person within 48 hours of starting symptoms who is considered to be a close contact, less than 6 feet, without a mask, they are going to be quarantined for 14 days, with or without that person getting tested. I don't want you to worry that the kid who sat 3 seats down is going to go and get a negative test 2 days later and be back in school. A negative test does not release you from quarantine once you've been exposed.
If I can.
Can I just add, Dr. Silversmith? Oh, sorry, go ahead, Doctor.
I was just going to add on to that, that's really that importance of the mask wearing, is that all the evidence shows that when two people are both wearing masks, the chance of transmission goes down so dramatically. There are multiple reports from the CDC of things like hairdressers who are positive for COVID and are taking care of dozens and dozens of clients. If both people are masked, there were no transmissions. So that's why we emphasize so much the importance of getting your kid used to wearing a mask and wearing it to school, and why the teachers also need to wear the masks, is that's going to keep, as I see a question in the chat about, when are we going to have to shut things down? It is inevitable that there are going to be kids and teachers who come in positive with COVID-19, because we know that not everyone in our school district is following the same procedures, right? There are people who are going out, and also it's just out there. So that is going to happen. The question to me is, how do we keep it from spreading within our school district? And that's where those masks and those stable pods are just so critical.
I want to piggyback on that. There was a question in the chat, which I had heard as well, that Dr. Fauci states that eye protection is now becoming really important. And do we recommend goggles as well, or face shields for kids in addition to masks?
I don't love face shields, to be honest with you. I don't think they afford a whole lot of protection. They do if you are up close and personal with somebody, where you're looking in their ears, you're looking in their mouths. That's why you see doctors wearing face shields. I do think goggles are helpful, whether it's even just a pair of routine eyeglasses. I don't think they need to come in wearing swim goggles or ski goggles. But we're not going to say that your child cannot have them. If it makes you feel more comfortable, yes. Right now, as much as the school wants to protect your child from getting COVID, our goal is to prevent your child from spreading COVID. And that's the importance of why we're enforcing masks. We're not going to enforce goggles, because goggles don't do anything to prevent you from spreading it. It's not shooting out of your eyeballs. So if you feel better with your child in goggles, by all means, send them with goggles, send them with glasses, sure. But I think what we really need to stress is, as a school district, it is our responsibility, much like vaccinations, to prevent the spread of illness to others. We are not only looking out for your individual child, we're looking out for every student that steps foot in the building. So goggles will do a wonderful job to help your child, but certainly the reason we're not going to mandate it or say it's necessary is it's not going to help anybody else.
Next question. Will students who travel within 14 days of school starting be required to quarantine before returning to school?
Again, I mean, the questions I love are the ones that we have hard answers for. And that one, the state has very kindly given us an answer. If you travel to a state that is on the list of states that require quarantining, yes. So if within 14 days you travel to one of the states that has a percent positivity over 5%, which is very easily accessed on the Johns Hopkins site, you will be required to quarantine for 14 days. So we will not have students starting if they came back 2 days ago from Florida right now. That being said, currently the state does allow you to be released from quarantine with a negative test. Don't fully understand that guidance. I don't know that I agree with that guidance, but right now the only thing we can give you is the answer that the state has given us. And the state says that if you travel to a high-risk state, yes, you have to quarantine for 14 days unless you have proof of a negative test.
Next question was the concern that children would be sent home with every time they get sick, even if it is not related to COVID.
It's a big concern. Oh, it's a huge concern. Absolutely. And I think that certainly until we have significantly better treatment modalities and a vaccine, I do believe that, yes, we are going to be sending home a lot of kids who have, rhinoviruses, enteroviruses, adenoviruses, strep throat, influenza virus. So yes, we will be sending kids home who do not have coronavirus. We know that. Whether or not we should be doing that all the time is definitely debatable. But certainly, I think that until COVID is not a concern, that we have the death rates that we have, kids will be sent home at times, unnecessarily, because it wasn't COVID. But again, I think that that's a point to emphasize for people. We will be living with COVID for years. This is not going to go away once there's a vaccine. What we're going to get to, ideally, is a place where we can live with COVID the same way we live with influenza and adenovirus and enteroviruses. The goal is simply to make this like the flu. I know in the beginning, that's what a lot of people thought, that this is just the flu. This is not the flu. The death rates, the morbidity, the mortality is through the roof. But eventually, with better treatment, with vaccine, we will live with this virus. And then whether that is in January or whether that's next September, nobody knows. But I want people to fully understand that this is not forever. But I think the better job we do now, the quicker we get there.
Can I add, so nurses are not legally allowed to diagnose. All we can do is look at the symptoms and refer. So we probably will be sending a higher number of students home than we normally would. And we have guidelines to go through for that. But I would like to say that if students have chronic conditions, like I think there was one in the chat about a chronic cough for an asthmatic, if we can get medical documentation for that, because we don't know all your students, that would be very helpful when we're deciding when it's time to send a child home.
I just want to comment on one thing that was mentioned in the chat. Somebody did mention that we are above 5% positivity. It's a pet peeve of mine that we have two very, very, very different statistics. Our Department of Health has, for months, had us well below 5% positivity. Even as recently as the last few days or week where we have had spikes, we are below 5% positivity. When you look at the number of new cases per day divided by the total number of cases, the total number of tests that were done that day. Johns Hopkins is using a different formula, and their formula is using number of new cases over people who were really tested for the first time ever. So it is claiming a significantly higher positivity. So I don't personally believe we're over 5%. It bothers me that Johns Hopkins, which is what we're using for every other state, puts us there. But even if we are, right now we are at worst just above that 5% number. I think that what we should be looking at is the data that our state gives us.
And the other part, Howie, that I'll just add on there is that that's for the state as a whole. And we actually know that the positivity rate in Providence County is much, much higher than here in Kent County. And so one of the things, so I'm obviously not the school district's pediatrician. As I said at the beginning of the call, I defer to Dr. Silversmith about just about everything. He's my kid's pediatrician. But it's important to know that we do look at community rates and that our rates here in East Greenwich are much lower than the rates in Providence County, which matters too.
Next question. If my child is sick and I am unable to pick them up, what would be the next step?
And I'll respond to that. So we will be asking parents and families to be sure that their updated emergency form, which you complete every year and submit, is absolutely accurate. And the expectation is that if you're unable, that in that emergency form, you have somebody that can be contacted and come and pick up your child within 30 minutes of that phone call. Because we are going to have to be ensuring that if a child is presented with symptoms, that they're removed from the school setting. We may have more than one child that has come or presented to the nurse and how we handle that. So again, those are going to be expectations that we're going to be very clear on. We're going to be using our Aspen Family Portal as ways to update that information. Families will have the opportunity to update that information. And that is where we expect the attestation form to be submitted as well. So we're trying to be mindful of, not asking folks to, navigate many different portals or, apps or things of that nature.
Just to piggyback on that, what would be the protocol if a parent refuses to pick their child up because they don't feel that they need to go home?
Let me try to answer that question. We would continue to say to the parent, we really need, it is expected that you will come get your child. It is creating an unsafe school setting. And we're required based on the Rhode Island Department of Health for you to get care and be seen by a medical professional or contact a medical professional.
Sorry to throw that at you.
That's all right.
Leslie, can I say also, so when we have those emergency forms, please update the emergency forms to the most accurate information. There's many times we'll call numbers, out of service or whatever, and also be mindful who you're putting down as your contact information. So say, moms, dads can't pick up their child, but then, their emergency, somebody else can, and then the family. Think about, could they possibly not do well with COVID as an 80-year-old grandparent or somebody that's immunocompromised? You might not want them picking up your child if we're sending them home because we think they may be sick.
And to piggyback on that, should students who live with an at-risk family member not risk in-person learning exposure?
So I've had this conversation with a handful of parents recently, and it's a very individual decision. And we certainly do know that there are risk factors that seem to be significantly worse than others. We know that age is the biggest risk factor. We know that heart disease, diabetes are big risk factors. I do see that somebody put in the chat about the Red Sox pitcher who has heart complications, who was young and healthy. We don't know who is at risk. We don't. So I do believe that it is very much an individual decision. We know that in New York, when there were enough kids infected, there were enough kids who had complications, and we don't know if those are going to be short-term or long-term. So I think that in this instance, it is up to every person to take a very hard look at who their child is, who they come into contact with, parents, grandparents, and how at risk they are. But yes, I think that if you're living with an 80-year-old grandparent who has heart disease and diabetes and is overweight, that's a risk factor. It's a big risk. And I think that is why the school has come up with such a wonderful plan of multi-layered approaches to how to educate your child. It's not easy. It's certainly not easy. And the school system is doing an incredible job to have options. But yes, I think that this is a year that if you feel that there is somebody at high risk in your house, think about that now, get in touch with the school district and make plans for virtual learning. But it is very much an individual decision. And we do have some people who are utilizing a low risk situation that they're concerned about and they want distance learning, and others where personally, I might say that the child should stay home, but the parent is willing to send them. It is very much an individual decision.
Thank you. I'm going to turn this over to Bonnie.
Bonnie, you're muted.
Sorry, that's totally muted. Can you hear me now?
Yes.
Okay. So this category has to do with sick teacher and student policy in response to positive cases. So I think we elaborated on some of these questions already when it came to isolation and quarantine. But the first question is, do you have a plan and can you share details of how the school will respond when a staff member or student inevitably tests positive for COVID-19?
So we have what we have discussed as a district and among ourselves, but we wait for that playbook from the Rhode Island Department of Health that will give us the actual, roadmap, if you will, for how we will respond. So there will be, prior to opening, we are guaranteed to have that, and I would guess you will have even more information tomorrow, you meaning our school nurse teachers, after you meet with the Rhode Island Department of Health.
Okay. There was a follow-up question attached to that said, how will the response differ based on the number of cases, and what would be the protocol for staff and children who they have been in contact with? So I think that still just reverts back to the same guidance that we're anticipating, unless anyone else wants to elaborate on that.
I'll just add to you, Bonnie, in terms of, the contact tracing on the buses, and, it is expected in every classroom that there will be seating charts. That's part of the guidelines that we received from RIDE. There will also be assigned seats on the bus. So, when there is a positive case, we have to make the call to Rhode Island Department of Health, we'll have that information readily available. Who was sitting in what proximity, near to whom on the bus or in the classroom.
Okay, the next question, what would be the standard of allowing a recovered child back to the classroom, given it is possible to get it multiple times?
So again, it's a question that right now we have a good answer for. A student is allowed to return once they are fever-free for 24 hours, their symptoms are resolving, and it is at least 10 days from symptom onset. Then they are allowed to return. In terms of whether or not they can get it again, should they get a fever again, should they get COVID again, that whole timeline resets. But no, once they have had COVID, they are subject to the exact criteria to return to school. So, it does not mean that they can't get it again. It doesn't mean that the next time they get a fever, they're allowed to stay. Right now, until we have better data that second infections are either less severe or, more importantly, less contagious, that child, A, will meet the initial criteria to return to school, but then as soon as they do, they are treated like everybody else, and they are subject to being sent home and quarantined again if needed.
Okay. Next question is directed to Alexis and Howard. And again, I think this might be very similar to some of the other questions we've addressed. What will the new sick policy be, and how will extended absences due to traditional cold symptoms that would not have kept kids from school in the past be addressed? For example, my daughter typically has a lingering cough every winter. Will that prevent her from attending school in person until the cough is gone? And if so, will distance learning be available by the time she needs to be out?
So if a student has a lingering winter cough, most of us as pediatricians do not identify that as a contagious illness. Yes, it will be hard to sometimes distinguish at first, but most pediatricians know our patients that have a chronic winter cough that we do not treat with antibiotics. We are typically treating with asthma medicines. So I think that will be a conversation between the parent and the pediatrician. And as much as I'm not looking forward to an overwhelming amount of paperwork this winter, I know I will have that, but with a note from a doctor stating that the symptoms are not consistent with COVID, your child will be allowed in the classroom. That being said, if your child is typically somebody who gets sick frequently with runny nose, cough, fever, which absolutely some kids are more prone to, that child will likely be held out more than normal, and it will be on the school district to be understanding of A, more than 10 days of absence, and B, how to teach that child virtually, because we do understand that many kids will be over the number of absences that we typically like.
Okay, so this has this next section is several questions that we're addressing: chronic medical concerns, special needs, and vulnerable populations. So the first question is, what, if any, direction is there for parents with kids who have asthma But the follow-up to that was particularly regarding nebulizer treatments at school and chambers for inhalers.
So chambers and inhalers are fine. There's been no data that really you do see spread with that. Nebulizers will not be administered this year. We do know that nebulizers are an aerosolizing procedure. They greatly increase the risk of spread of COVID. I think that for the most part, if a child is requiring nebulizer treatment throughout the day, here's an instance where, yes, even if it's asthma, your child may be kept home if they do not know how to use an inhaler and a spacer. But we do know that right now, using a nebulizer is just too much of a risk to our school nurses that, as a school physician, I am very uncomfortable with. I think that it's very, very hard for the school to function without a handful of teachers. It's very hard to function without a principal, but I think people have to fully understand how hard it is to function without one school nurse, right? I mean, everything we're doing involves being able to have that nurse on site to assess your kid and decide what needs to be done. So I think we need to protect them at all costs. And nebulizers are one of the few ways that we know aerosolizes this virus, which makes it incredibly more contagious. So for your chronic asthmatics, yes, they can take their steroids at home. They can do a nebulizer at home. We can administer inhalers with spacers in school, ideally with less assistance from a nurse. So please go over it with your child, but there will be no nebulizers.
Okay, next one. My niece has pulmonary hypertension. If my children go back to school, I feel we will not be able to see my niece in person because we could be putting her at risk for serious adverse event. Do you agree? And do you have any other advice for families in similar situations?
So again, my advice is it's a very personal decision. And, you know, I was on the phone with somebody yesterday whose husband is in and out of ICUs with diabetes, and she feels very uncomfortable sending her kids to school at all. I understand that. There's a big spectrum of immunocompromised people and respiratory compromised people and cardiac compromised people, but I think it's going to be very much on people individually to decide what type of risk they're willing to take with their child, with themselves, with their loved ones. And yes, I do believe that if you have a relative or a loved one who is at significant risk, if you are sending your child to school in a time where there is circulating COVID, you are risking that your child will come home with COVID, and you do want to limit who that person has exposure to. I also want to state that there's a difference between not seeing that person. So first of all, I think we're all getting more accustomed to Zoom meetings and FaceTime. So it is a way to stay socially connected. I think that it is okay to go to somebody's house and be in their yard while they're in the house and talk to them through a window. You know, I think that there's other ways to maintain social connection without saying, well, if my kid goes to school, that means I can never see my niece for a whole year. No, maybe you can't see them the same way. Maybe you can't hug them. Maybe you can't kiss them. Maybe you can't have the same contact that you used to. But I think we need to be a little creative in maintaining social structure and socialization without putting people at risk. But again, I'll go back to the initial thing. It is individual. And if it makes you uncomfortable, either A, seeing that niece, then you shouldn't. If it means that you won't send your child to school, let the school know as early as possible and virtual learning will be set up. But I do think that especially now, we need to be creative with our vulnerable loved ones.
Bonnie, you're muted again.
Sorry. So the next question is actually a little more unique than what we heard before, and it's directed to Alexis and Howard. And it's a question about a mom of a child who has ADHD and not being sure about how the child will cope with being in the same spot, in the same room all day. What are your recommendations to address the need of all children really to move and be active during the course of the school day?
It's a fair question because, you know, as I've often been heard saying, what we think about school or the way we thought about school in September of 2019 is not the way we're going to think about school in September of 2020. We're just in a different, you know, scenario right now for all of us. So but I will say that, you know, recess is allowed. And I know the school principals have already been working on how they're going to navigate that and how they're going to make space available. You know, students can be outside. They can, you know, play with balls. We had those conversations. If there's some outside recess type things, they can play with it inside their stable pod that will then need to be disinfected after that. 2 classrooms can be outside as long as there's 14 feet of distance between those 2 stable pods. I know that there will be brain breaks and different opportunities for students to move around in their classroom, but there's no, you know, it is clear that there will be far less movement inside the school building than there was before. It just has to be limited. The school nurse teachers are talking about how a student would access the nurse, what protocols will be in place. We have very specific guidelines about the way children are going to navigate the buildings, one-way hallways, appropriate spacing between students. So it will be different, but structures are set up so that we can have in-person learning in the safest possible manner. And Dr. Silversmith, you have always said that, you know, our strategy has to be not to prevent, because, you know, that's not a reality, but it is mitigating, you know, the spread of the virus is our goal.
Okay, the next question actually has to do with the hygiene expectations for a child who is intellectually disabled and nonverbal. What are the recommendations with regard to reopening and the fact that this child would have difficulty accessing remote learning?
So I've actually had a specific conversation with Dr. Silversmith about that, and with our Director of Student Services, Dr. Hughes. And we've settled on that those need to be direct conversations with the parent and with student services or the service provider about what appropriate PPE we need in those settings and how we support that child to be able to safely come in school.
Okay. So the next question is directed to both Alexis and Howard. There has been some preliminary special education service delivery models that seem to broaden the number of pods a child with an IEP will be exposed to. For example, a Cole Middle School student may be in a general ed pod, in a resource support pod, and then get group speech, OT, etc. That could easily double their exposure. What would you suggest medically regarding this?
So medically speaking, again, I think that everybody needs to understand the concept of the pod. The concept of the pod is, yes, a little bit to minimize your exposure, but the biggest concept of the pod is contact tracing. That's what it's all about. It is really so that we know exactly who came into contact with this person. And in a scenario like that, you know, yes, that is a nightmare scenario for the Department of Health, where they now are not contacting 15 people, but maybe 30 or 45. So that is a problem in terms of it makes contact tracing more difficult. I think that individually speaking, if a family is going to say, I don't want my child to receive speech services this year because it's going to increase their exposure, that is a conversation between that parent, their child's pediatrician, and the 504 team, and the IEP team. So individually speaking, everybody needs to decide, okay, am I willing to have my kid miss 1 month, 3 months, 1 academic year of their special education services? And I'm not the person to answer this. I don't know whether or not you're allowed to opt out of certain things, but those are conversations where you need to weigh risks and benefits. But when it comes to just crossing pods slightly increases your child's exposure, but really what it does is it makes contact tracing significantly more difficult. That's really where it complicates matters.
Okay, thank you for that. Now we're going to turn things over so we can have Andrea take over with directing questions. The next set of questions pertain to immunization, vaccinations, and COVID immunization. All set, Andrea?
Okay. Yep, I'm all set. The first question is, what do you think about the safety of kids getting the vaccine when it is available, when it has only been tested on adults during the trial period?
So if it makes people feel better, right now, anybody who wants to, who is over the age of 18, can go online and can sign up to be in a vaccine trial. There are currently 3 vaccines being trialed in the US. There's the Moderna vaccine, the Oxford vaccine, and the Pfizer vaccine. If it makes people feel more comfortable, my wife, myself, my 20-year-old son, my brother, my sister-in-law, and both my 75-year-old parents are on the list to be in those trials. So when you say to me, do I feel comfortable with the safety of the vaccine? Absolutely. Is it being hurried? Is it being rushed? Does it make me slightly uncomfortable? Sure. I wish we had the time to study these vaccines the way we normally do with vaccines, but we don't. We need to come up with something sooner. And this is my personal belief. I don't have concerns over the safety. I have concerns over efficacy. I don't think any of those vaccines will be a magic bullet, but I do think that the quicker we get data on them, the quicker we could start using them, the better. If it makes people feel better, I don't think your children will be allowed to get the vaccine in the first few rounds. This is the exact opposite of what we normally do. We normally study vaccines in young, healthy adults, and then we give them first and foremost to young, healthy kids. This vaccine will be studied in all comers, 20 and up, including elderly, including people with medical conditions. Once those small studies, again, small, we're talking 30,000 people enrolled in phase 3 trials. Once those are done, the initial wave of, whether you believe 100 million doses are hitting the US this year, but those 100 million doses are not going to your kids. This is not what we normally do. It will not be, hey, it's safe, let's give it to kids because they're most at risk. It's going to be, hey, this is safe, let's put it in the nursing homes. Let's give it to our frontline workers. My hope, let's give it to our school nurse teachers and our teachers. I think they are critical and essential care workers. But your children will have hundreds of millions of doses of experience before we are putting it into their arms. So as a pediatrician, and I know I am the pediatrician for many of you on this call, yes, I would love for your kids to get this vaccine as soon as we can. Part of me is happy to hear that 50% of America doesn't want it, because when I convince my patients to get it, there will be enough vaccine for them. But right now, I don't want you worried about the safety of the vaccine for your child, because that's a prayer. That's not a concern. I mean, my hope is we can give it to them. But don't worry about it. It's not, your child's not getting it in October, November, December. By the time they do, there will be hundreds of millions of doses given around the world, and we'll have very, very good safety data.
The next question is regarding 504 plans and individual healthcare plans. If child already has a 504 plan in place, will it still be in effect next year? And who do I contact with regards to updating or creating a new one for the year?
So it was a little jumbled. I couldn't catch the whole. Say it again.
Are you able to hear me now?
It's a little bit jumbled, Andrea.
Okay, I'll try again. This is regards to 504 plans and individual healthcare plans. If someone already has a 504 plan in place or an individual healthcare plan, will that still be in place for the new school year? And if I have questions regarding this, who do I contact?
So I think that's you know, the person, it depends on the nature of the 504 plan, but if it's a medical plan, you would call, you know, the school nurse teacher at your individual building. Or if it has something to do more academic in nature, that would be the school-based principal or the guidance counselor.
The next question has to do with hand washing. Will the kids be hand washing before meals, or will hand sanitizer be the main source for cleansing? And will there be a hand washing schedule considered for the kids?
Yes. Do you want me to take that one? So, or Bob, do you want to take that one? I can take it.
Sure. Yeah, I mean, we're going to be washing hands and sanitizing very frequently. I think that's
And
what
you,
everybody expects, and that's what we'll be doing. So before lunch, after lunch, before class, after class, when you pick up a pencil, after you pick up a pencil, wash the day away.
but you've also bought extra sanitizer locations and things, you know, kiosks or whatever we're calling them. More access to hand sanitizer.
Literally littered with hand sanitizer.
Okay.
And we nurses are going to encourage hand washing with soap and water, warm water, the majority of the time, because that's probably better.
Yeah.
The next question has to do with PPE or personal protective equipment. Who will be training the teachers and the students with the skills?
I didn't catch it all. Who will be, can somebody clarify that?
Who's going to train the students and the staff on how to wear PPE?
So the students and the staff don't really need to wear PPE. The students and the staff need to wear their mask. And again, it's why I started earlier in the conversation by stating, start teaching your kids now how to wear a mask. Somebody brought up goggles, and if you want to teach your kid how to wear goggles, that's great. But the school nurse needs to have PPE. They're going to be the ones who are coming into contact with people who potentially are infected. Whether or not a teacher would like to wear a face shield along with a mask and goggles is again up to every individual teacher. But I think when it comes to what people are seeing on the news about full PPE with gowns and gloves, that's if you're coming into direct contact, you know, with COVID positive patients. And our goal is to be minimizing that. You know, I really, I'm really hopeful that nobody else needs PPE short of their mask and hand washing.
The next question has to do with social emotional. Most of the questions that are submitted for social emotional will be addressed to the social emotional forum. But how are you going to manage the anxiety these physical conditions engender, such as mask wearing? I think we've kind of gone over that with regards to anxiety and mask wearing.
Well, we've gone over anxiety with mask wearing, but I don't want to, and I know that there's going to be a social and emotional forum, but I do think that it should be addressed here a little bit as well. And I do want everybody to be fully aware that as a school district, it is what keeps us up at night. We fully understand that the social, emotional, academic, athletic consequences to your children of not being in school the way they are used to being in school is a huge concern. It's a huge concern. And we do know that the medical risk of getting COVID is fairly minimal. I don't want to say it's nothing because we don't really know that yet, but it is fairly minimal. So it is exactly what keeps us up at night. How do we provide for the overall health of your child, which nobody on this call minimizes their emotional health, their social health, and again, their academic and athletic health. I don't want people to think that those things are being lost on us. That is what we weigh. So please understand that if your child has anxiety or depression, we want them in school. We want to be there for them. I think oftentimes that school nurse especially at the high school level, is probably somebody that gets confided in before some parents, before some friends, before pediatricians. So we want to be there for them, and we don't minimize it, but we have to weigh the consequences of allowing unmitigated spread, which I'm hopeful we don't have. You know, I'm hopeful that we can do this successfully, and I think that we're putting so much time and effort into it that we will. But again, don't think that by saying, oh, we're going to have a health and wellness forum for mental health at another time, we're not thinking about it. It keeps us up at night.
Absolutely.
The other thing that if I can just quickly add there, I think, so as a parent, many of you know I have 2 kids in the school system, and I've already started talking with them about the fact that going back to school this year is going to be different. That my daughter is going to middle school for the first time, and that she can't expect it to be what it was going to be. My son can't expect Hannaford to be what it was. And I think the more that we can prep our kids for this and normalize it for them, and I know that we all have anxiety too. I mean, that's normal as well, but we can create that environment for them. And the other thing for all of us who desperately want our kids back to go back to in-person school for their social and emotional well-being, that's also on us as a community. Our behaviors today determine whether or not our kids are going to be able to go back to school on August 31st. And so the more that we can do social distancing ourselves, the more that we can wear masks and follow those public health regulations, the better our chances of being able to open school on August 31st for those kids who need to be there and for those families who feel that it's appropriate for their kids to be back in in-person learning. So if for us as a parenting community, how much we play a part in this with our teachers and with our school district.
What can we do as parents to support the social and emotional stress of our child? What are the cues that we should be looking for?
So talk to your children, right? You know, I think the cues are oftentimes the first thing is they get a little quieter or they get more withdrawn. And I'm certainly not a mental health expert to be commenting on all of it, but talk to your children, talk to them every day, ask how they're doing, ask how their friends are doing. Sometimes when you ask how their friends are doing, it's a little bit of an insight into what world they're in. But talk to them every day, ask them how they're feeling, but that's the best thing. And again, talk to their pediatricians. You know, it's what we do. If you have concerns about your child, talk to your pediatrician. Every one of us is open. We are seeing people in person. We are doing telemedicine. So there are many ways to get in touch with us, but certainly if you have worries or concerns, approach your child's doctor.
The next group of questions have to do with social distancing, and the first one is for Meyer. How are students going to safely distance themselves in a classroom when the rooms are too small to accommodate them? And what is the social distancing requirement in East Greenwich grades K through 5 that allow up to 30 students and staff in a small classroom?
So I think I caught most of that question around social distancing and K-5 I heard. You know, as you know, the plan that we submitted to the Rhode Island Department of Education addressed all of the scenarios that we were asked to address. But in addition to that, we made an intentional recommendation based on the ability to provide the necessary spacing consistent with RIDO and the CDC, that all that our schools all be at the 50% attendance rate on those, attend 2 days. One group attends 2 days, another group attends the other 2 days. We have increasing enrollment in East Greenwich, so our schools are at more than 100% capacity in most cases. So in order for us to have all kiddos in at the K-5 level, we don't have the actual 6 feet in every setting. We have removed furniture and put them in trailers or in the process of doing that. The guidance that came from RIDE and the Rhode Island Department of Health recommended 6 feet, if possible, was the language that they used. So we are utilizing every little iota of space that we have in the classroom to create the appropriate distancing. Go ahead.
This question is for Mrs. Meyer and Dr. Silversmith. Governor Raimondo has just reduced the number of social contacts per person down to 15 people. Based on the fact that these grant students will be changing classes and have no possible way to limit their exposure to the recommended stable pods of 30, never mind 15, how can this be safe?
So again, we addressed this a little bit earlier. I think the governor is doing an amazing job of keeping her eye on the ball of being able to safely open schools a month from now. I think that she has pivoted from sustain our economy to making sure we can open schools. The fact that she took a step back while staying in phase 3 of reopening is really with that intent of being able to open schools. I think we have to really understand that when we're looking at what guidelines are for summer activities, for social events, and when we're looking what guidelines are for school, they're different. They're different. It is because you don't need to have a backyard barbecue of 50 people. You could have one of 15, but we need to educate kids. So I think what the governor did was not safe to have more than 15 people together. She said, it's not necessary to have more than 15 people together. Let's take a step back. Let's stay in phase 3. We're still meeting most of the criteria for being in phase 3, but let's get things under control so we can safely open schools in a month. So again, I don't want anyone to interpret, social groups of less than 15, weddings of less than 50 as magic numbers, that those are numbers of safety. Those are numbers to maintain an R value, a spread of less than one person giving it to one other person, so that we are reducing the number of cases over the next month and not increasing the number of cases over the next month.
Okay, I'm going to turn it over to Mrs. Simmons, who is going to be taking over with regards to questions in buildings and facilities.
Okay, will do. Most of these questions are directed to Mr. Wilmar that have to do with specific issues regarding the building and facilities. What systems will be used to remove the virus from the air? Air purifiers, UV, where and how often will these be used? And have buildings been updated with new ventilation systems? And how often will indoor air filters need to be changed to keep air viral levels healthy?
Well, it's about 19 questions, so if we can just do them one by one.
Sure. So the first question, what systems will be used to remove the virus from the air?
I mean, I think if the world has figured that out, it would be news to me. We wouldn't
Where?
be
Yeah, go ahead, I'm sorry.
I mean, there really isn't anything that we can do to remove the virus from the air. The only way to do that really is to wear masks.
Have the buildings been updated with new ventilation systems?
No.
How often will indoor air filters need to be changed to keep air viral levels healthy?
Filters that we have in place on our systems don't filter the air inside the buildings. The air inside the buildings is all exhausted out. The filters on our systems are filtering the air that's coming in from the exterior of the building, and it's really just there to catch dust. And so while we have MERV 13 filters in place to catch all the dust that we can, there really is no viral mixing.
Okay, next question has to do with how many children will share a bathroom, and will toilet seat covers be installed to all bathrooms?
We will not be installing toilet seat covers. We will be sanitizing the bathrooms very frequently, and the kids will be assigned bathrooms based on their location to bathrooms. So some particular instances, there might be 60, 80 kids using a bathroom, but that bathroom is going to be sanitized dozens of times a day.
The next question is, how can we be 100% sure sure that the building will be properly cleaned and disinfected each night?
It's a good question. I think you're just going to have to trust me.
I happen to know.
Bob, you know,
Yeah.
give some details. We had the core assessment, and you know, we've had some people come in and give us some guidance on how to properly sanitize, and we're using that guidance, correct?
Yes. Yep. We're going to have 2 additional custodians in each building who are walking around sanitizing everything, on top of the normal daytime custodian and the normal nighttime custodian. So our custodial forces has been doubled in order to sanitize for this virus.
Okay, the next question is concern about how the use of disinfectants will impact the air quality of the schools. This particular individual had concerns about their child having sensory issues and being affected by smell. What disinfecting products are being used, and are the buildings going to smell overwhelmingly of disinfectant?
I would probably say yes, because they're going to be disinfected all day, every day. So yes, I think they will smell like disinfectants. Do all disinfectants smell like bleach? I would say no. I mean, some of ours smell sort of flowery, and it just depends. The types of disinfectants that we are using chiefly are a product called Rejuvenol from our Hilliard, who's a manufacturer of chemical products for cleaning schools, and another one called Oxivir, which is a product that is just made for disinfecting, along with the different types of hand wipes and the hand sanitizers. Really, we try to get things that don't have much of a scent to them, because there's lots of folks in the buildings who are prone to having sensory issues around scents. And so we've never had any problems with the products in the past. We've been using all of these products for a very long time. And while we might be using more of them, I don't anticipate any issues.
Okay, the next question is, have we installed any plexiglass around desks?
We have not installed any yet, but we are doing that.
Okay. And are there proper procedures to throw away gloves, paper masks, cleaning wipes?
Throw them in the garbage and we'll take the garbage out. I mean, I'm sure there is a procedure for the correct way to de-glove in a hospital setting when you're trying not to contaminate anything, but I'm not exactly sure that that's what we're trying to do here. So I think if you can figure out how to take the glove off and throw it away, we'll be okay.
The school nurses have addressed this with our principals, that we will be having foot release trash cans in each of the rooms, where the kids can step on the foot release and put their mask. And we have the red trash cans in all our nurses' office, so the masks aren't going to be floating around.
All right, so Denise, if you want to take over, there's another set of questions. It looks like it's related to building and facilities.
So Bob, real quickly, just out of curiosity, are our MSDS information sheets available online for people to look over?
Denise, you're breaking up. You broke up on that.
Can you hear me?
Yes.
Bob, are MSDS sheets available for the public to look at, of the chemicals that are in our building?
Yeah, they're available to anybody who wants to Google it. Oxivir, Oxivir, and Rejuvenol, Re-Juve-Nol. It's part of the Arsenal cleaning line from Hilliard. The MSDS sheets are available. I can send them to whoever's interested. We could post them online if we wanted to. They're available on the internet.
Okay.
Along with every
what
other
measures will
product
schools?
we use.
Thank you. What measures will schools take to address the heat in the buildings? Fans, air conditioning? What will staff do if students feel the need to remove their masks to breathe due to heat and minimal airflow? And are fans allowable?
So we had the question about fans at another meeting. So the fans, and I'll defer to Bob or Dr. Silversmith. The fan has to have the air heading out, being pushed out to the window, I think. is what I heard, or is what we understood from last time. I see Dr. Silversmith nodding his head. We have
The idea with the fans is that air that's coming off of the fan is not circulating directly on the occupants, blowing across occupants, and potentially spreading the viral load to the occupant sitting downwind from the initial occupant. I believe that's what the concern is with fans in the classroom. Unfortunately, the cooling effect from a fan doesn't work unless it's blowing across you. So you're kind of out of luck for a cooling option when it comes to fans, I believe, unless the good doctor wants to contradict me.
No, I think that, we're in for a year of discomfort in a lot of ways, and certainly if it's unsafe to be in the building because it's too hot, we've had those those times before, and schools been canceled because of heat. But I do think that we're looking at, windows being open, which is always a good thing in terms of minimizing viral spread. But I think that right now the last thing you want to do is fans that are, blowing back and forth, circulating over students and over the teacher. They do have window fans that you prop into a window to blow hot air out. I don't know how well they work. I don't know if it's worth it. I don't know what type of windows there are. But certainly I think that this year we'll just have to realize that we've got to keep track of how hot it is and that there's a little bit less ability to keep it cool.
Yeah. We really have very limited ability to keep it cool at all, even in a good year. I mean, some of the rooms are air conditioned, really only the rooms that need to be. But I guess the plus side of the systems that we have in place is that the ventilation systems that are in place in each classroom are bringing in a tremendous amount of fresh air from the outside. And so we really don't have a lot to worry about as far.
Oh, do we lose him?
We might have.
Okay.
He's working without.
Bob, I'm going to try. Yeah, Bob, I'm going to try and
Hello?
go quickly because I know your battery's getting low. Water fountains. So are the water fountains being shut off, and can the filtered water with the water bottles be used for students?
Yes, and you hear me?
Yep. You said yes and yes, correct? Water fountains are being shut off and filtered water will be available.
The water, the bottle filler will still be active, right? No touch.
Yeah.
Yes, so it's very important that students bring water bottles to school with them every day. Last question for you, Bob. With the recent FDA reports of several alcohol-based hand sanitizer being found to be contaminated with methanol, what alcohol-based hand sanitizer will the district be using in the buildings? This is especially a concern for special education children who often have their hands in their mouths.
We do not and are not able to alcohol-based hand sanitizer. It's not only a health concern, but also a fire hazard. So we don't have a problem with methanol.
Great. Moving on. So Mrs. Meyer, these questions are for you. There's just a few more. And I want to reiterate, we did get a lot of questions related to teachers and staff. We will be having a teacher and staff health forum as well. So I'm going to forward all those questions there. We did get a lot of questions for teaching and learning. So I'm going to forward all those questions to the reopening schools at EGSD.net. And we did get a lot of questions for the mental health and safety, social emotional group, which they're going to have a forum for that as well. And I'll forward those questions. But I did pull a few out that I thought our doctors could address, and they already addressed them. So these last three are for you, Mrs. Meyer. What sort of plan do we have to safely use substitutes with regards to exposure to other districts or classrooms?
That's a good question. Thank you, Denise. So, substitutes, and everybody readily acknowledge this, are going to be, in high demand, because every district will be facing just what we've been talking about people needing to quarantine and then needing to make sure that the children have proper supervision in the in-person setting. So we are working on securing our own subs right now. And, we'll be having conversations about how much, what typically our subs don't work at, frankly, many districts. They generally work in our district. And so I don't think that's a huge concern, but we will be investigating that through human resources.
Thank you. In the past, classrooms have been nut-free, but nuts and peanuts were allowed to be packed into lunches. If children will be eating lunch in their classroom, will lunches need to be nut-free as well?
I would think that we would have to have nut-free lunches and be very cognizant about which each school principal will rely on their school nurse teachers and information that comes with that gets delivered by parents to the schools or communicated by parents to the schools about what kind of settings we're going to have to create in the classroom related to known allergies. But yes, I don't know how that we would not be able to have a peanut-free classroom.
Okay, last question. Can you post questions and answers on EGSD website for those that can't attend?
Meaning, yeah, you mean this session or other sessions like that? So this session is recorded, and we are working on an FAQ. And actually the FAQ we're building from the emails that have been coming in through the Reopening Schools EGSD site. So we will be working that. We'll be happy to do that. An FAQ for you. And I would just say that, I know for those we still have 144 people listening. So thank you very much for staying with us for a couple of hours. I know it's really hard when we can't give you the most detailed answers to your questions. We feel the same frustration. So I acknowledge that, and I empathize with all of you and all of us as we're trying to work through this. As we have more detail, as we get more guidance, we will be sure to communicate what we can. Is that the last question, Denise? So
that's it. There's one in the panel. Really quickly, can students bring their own hand sanitizer?
I mean, they always have in the past, as well. Kids have done that. So I don't know that we wouldn't allow that to happen. I would certainly defer to any of our experts that would suggest that if we should be cautious about that, but kids generally have it on their lunch bags, a little container. So I would recommend that.
I would say that there's no reason a student can't bring their own hand sanitizer. Certainly, I would say that the ones that the school is going to be providing are all incredibly safe and incredibly effective. The qualifications for in-school hand sanitizer are much safer than any over-the-counter stuff. But certainly, if you feel more comfortable with your student bringing their own, that's not a problem. Are we done, Denise?
I think we're good.
Okay,
we're
so
done. I think we're good.
Before we totally conclude, just a few things. One, I think Dr. Rani stated it very, very well, that whether or not we open successfully really relies on what parents do from now until the end of this month. And it's not only what you do by yourselves or with your own kids, but what you look around and you see. And certainly our numbers have climbed slightly from the 50s to about 100. And we're the only ones that can reverse that. We're the only ones that can get ourselves off of the list of quarantining when we go to Massachusetts and New York and Connecticut. We're the only ones that can make it so that we can open the school safely. So please, please, please consider everything that you decide to do from here on out. Consider whether or not you really want to take that vacation to a high risk state. So one, we can make this more successful. We have control over that. So please consider it. Next, I do think it's important to understand that this is a fluid situation that is going to change. And if things are improving, we're going to be in a much better place. And if things aren't, we may have to take a step backwards. But understand that what we tell you on August 4th might not be what we tell you on September 1st. And that's just because we're learning more about this virus and we're learning more about what the spread is in the community. Lastly, and most importantly, I think everybody has to realize how special you guys have it in East Greenwich with a superintendent and with school nurses who care about your kids. In other states, they're furloughing school nurses. They're laying them off because school is not in session. Where you guys have school nurses and a superintendent who have worked every single day over the summer for your kids to be in school. I'm sorry if I'm emotional about it, but you have to understand that when you get upset or you get angry at them or at the school district, they're trying their best. And you guys really have to understand how lucky you have it, because whether they make the decisions that you would make or not, they are making decisions that they think are in the best interest of your child. And they have worked every day to make this happen. So I appreciate working with them, and I hope you appreciate them as much as I do.
Thank you for those remarks, Howard. Very much appreciated.
Thank you.
I'm at a loss for words, but I appreciate that. I appreciate your acknowledgement of that. I appreciate these incredible women that have said to me from the beginning, Alexis, let us take this for you. We have the expertise in this, and they've never let it down one day out of this summer. So we are regularly in touch with each other. And to Dr. Silversmith, for your incredible guidance, and Dr. Rani as well. You know, we can't do this without you, and I will tell you, and thank you for recognizing that I care about every child in this district and every staff member in this district, and that we will continue to, for that to be our mission, to make sure we can get our kids back in school safely. That's what we really all want, and do the best that we can do. Thank you. Thank you, everybody. Thank you. Be well.
Stay safe, everyone. Good night.
Good night.
Thank you.